Welcome to episode 245, Clinical Curveballs, Responding to the Unexpected with Ethics, Integrity, and Care, featuring Dr. Kristin Dempsey, licensed marriage and family therapist and licensed professional clinical counselor. Make sure to subscribe to be alerted about future episodes. By Clearly Clinical, learn, grow, shine. Hello to our listeners. My name is Beth Irias, and I am so excited to be joined today by Dr. Kristin Dempsey. Kristen has come on before on our podcast, and I asked her to come back for a conversation about sticky situations that come up in therapy. And I'm so grateful to Dr. Dempsey for coming on and being willing to talk about this, because I feel like this is one of those topics that we as clinicians are like, that's not going to happen to me. And then we find ourselves in a situation where we're like, I don't know what to do right now. So my hope is that this conversation will help us all feel a little bit more secure for the unexpected. Thank you so much for joining us, Kristen.
Yeah, thank you so much for having me. I'm really excited to be back. And as you're talking, I'm thinking, this might be one of my favorite topics to talk about ever. Because if you're really doing dynamic, I think good, effective work, it's going to get sticky.
It's going to get messy. When there's trust and power and all of that involved, it's going to get messy. For our listeners who are not familiar with your work, I would love for you to introduce yourself and tell us some more of your background. But I just want to say it's been my pleasure to get to know Kristen, and particularly just the way that she approaches care, and also this kind of backbone of change theory and motivational interviewing. And Kristen, I will let you take it from there.
Oh, great. Thank you so much, Beth. Yeah. So I am in the San Francisco Bay Area. I talk a lot about being from San Francisco. I'm very proud of the city and of Northern California specifically. And I've been doing therapy work as a counselor for about 30 years. Time just keeps kind of sneaking up on me. And right now, currently, I'm working in private practice, and I do training. And I train a lot in motivational interviewing, but I do other types of training as well, and tend to focus a lot on motivational interviewing and harm reduction and trauma-informed care, suicide prevention, intervention work, amongst others. And I have a history of working with community mental health. And I love community mental health. That's still where my heart is in so many ways. So I enjoy being able to consult with community mental health teams. And I really try to stay on top of, what's happening in terms of the overall context that's impacting therapy and therapists. So I have other interests and have done a lot of work in therapist workforce development. I think that's such a really important piece of all this work as well, which also brings me here to this conversation as well.
Fantastic. Thank you again for joining. Before we started recording, Kristen and I were talking about this topic. And one of the things we were talking about was the training that we get as therapists for like your ideal session when you're following a treatment plan and you anticipate, working on that insomnia is going to take about 8 to 12 weeks. And then we talk about the severe crisis situation where like, that you need to call the authorities, that you need to call Department of Child and Family Services, whatever it is. And then there's this whole area in between those two extremes, those two poles that we really don't talk about very much. And I was telling Dr. Dempsey before we started recording, when I was in my internship, wee baby therapist, as I say, I was working quite a bit with individuals who had substance use disorders and had been court referred. And one of my clients came in very clearly under the influence. And no one had talked to me about what I'm supposed to do in that situation. And there was what I did and my reasoning behind it. But it really started to draw my attention to that stuff that we can't anticipate. And it's like, how do we make decisions? How do we cope? How do we get through it? Dr. Dempsey, take it from here.
Yeah, I was just thinking when you're talking, really the sense of continuum, right? With like the perfect situation and then like the real like dangerous, challenging situation and everything in between. I appreciate the continuum kind of idea around that, because really most everything we see is everything in between. That perfect situation is never perfect because we have real people we have to think about when we're putting together and really implementing treatment. Like the real person shows up, and their reluctance and their ambivalence and all the stuff that makes us. If change were that easy, we've done it already. And then at the other end, with the real difficult situations, fortunately, those don't happen too often. We're always concerned about those, and good that we're preparing for that. But yeah, then there's all this wilderness kind of in between. And you're right. Like, I remember, too, being trained, and the way I was trained was just like, okay, if they come in with a substance, like, no. Like, they need to go home. Like, you need to get them home, make sure they're home safe. Just no, you can't do that. And, of course, then you go out and do this work. And the reality's much, much different. Like, so many people show up with some level of substance. Like, that's part of what the challenge is that maybe they want to work on. Again, if it were easy for them to stop using, they would have stopped and then come in. Like, if they were going to be completely absent to begin with, maybe they would be talking to me. And there's such different types of relationships that people have with substances, for instance. And so I'll put out there that what I learned over time, and this was just kind of my own realization, then later on I had other good folks I was working with really affirm this, is, people can be using substances, and for many folks, they're functioning at a certain level of substance all the time. I mean, to be honest, I'm functioning on coffee right now and caffeine, like really, very intensely every morning myself. But I understand we're talking about the things that might be more creating impairment, and that it doesn't mean if someone comes in and they've had some use that they're so impaired that they can't actually benefit from the work. And so there's that. But then there's also the piece, too, that people can come in and maybe I don't even know, right? Like, it might just be like that's just kind of their baseline. And yes, I've had folks come in and they sat down next to me, and I actually literally had someone come down and sit. It was in a group situation, and they basically passed out on me. I've had someone like fall down and, in a clinic, where they're coming in, they were falling down because they were so intoxicated. Like, I can tell you these things and count them off on like one hand. And of course we got them care and took care of them and stuff. But the great majority of folks are functioning in some way, and wouldn't even necessarily really know, but certainly this idea of, do we withhold treatment from them? Do we say no? And there's such an opportunity for them to benefit from having a conversation and engaging.
One of the difficulties that I see in the field as a law and ethics trainer is the ambiguity around ethics, and sometimes the interpretation that they are concrete. And going back to my example, so wee baby therapist, a toddler, my decision in that moment was not to end session. I knew that client wouldn't be driving. They did not have a vehicle. So my decision making, and like I can easily transport myself back to that moment, where my heart's like, like, oh my God, the person is totally wasted right now. My reasoning was, this person is safe. They have a ride home. This is a behavior that they have been engaging in for a long time before I was ever part of this equation. And something allowed this person to come in today anyway. They obviously could have not come. And it was pretty early in the therapeutic relationship. I think we'd had a handful of sessions at that point. And so I opted to have the session. And obviously my interventions and my approach were going to be different. But one thing I see is this idea, like you said, of if this happens, then we can't do therapy. You need to do this as soon as possible. And I know as part of our conversation today is kind of untangling, how do any of us make clinical decisions, especially when curveballs are thrown at us? I had no idea when I walked in that day with my cute little notebook with my initials on it, that was what was going to be waiting for me. And then I very quickly had to assess and pivot. And I should note, right now, Kristen and I are talking a lot about substances, but these curveballs come regardless of substances. So one of your focuses, Dr. Dempsey, is about harm reduction. Tell me, as kind of the backbone for our conversation, explain your perspective on harm reduction and how it fits into a conversation about managing these curveball sessions.
Yeah, so harm reduction, one way of thinking about it is I'll talk specifically around substances, but you can think about really any behavior. So maybe the treatment as usual or the approach as usual is like, we have to deal with this drug, or we have this substance, or this behavior, whatever it is. But harm reduction is like, we have to deal with the harm that this substance is causing. It's more about like dealing with the harm and helping to reduce the harm. Like that's the focus. The focus is, how do we help increase the safety of this person, as opposed to having the focus on this thing is bad, approach, right? This being like this problematic thing is like, how do we help keep this person safe? And so part of that is bringing people in and, helping them, create a relationship and have this sense of safety in the acceptance of their situation and their status quo. Like, I'm accepting you as you are right now. And there's a lot of trust and safety that gets built into that willingness, that openness to have that conversation. And that also, again, I realized when I was telling my story about, folks coming in, and you reminded me of this, is there are some definite, like, kind of ground rules around this. Like, if the person comes in, we're talking again about the substance issue, like, did they drive themselves? I mean, I will tell you, I've seen a number of people in many, states of use, and there's been lots of situations about getting rides home or taxi vouchers, or as a bottom line, like, I want to reduce the harm in the community as well. So that's like kind of a bottom line I certainly have in terms of creating like community safety. But a lot of times it's like, what can I do to apply what I know ethically to this situation? So it's so much about context, and that these like kind of static and concrete legal and ethical rules, like, it really needs to be brought into the current context with which we are working with someone. And so what kind of resources do I have at hand? Like, in community settings or group practices, it's great because you can have a community that you can set up or establish, or have a way of consulting with people. I'm big into consulting in every possible way. And there's other options as well. Maybe if you're a member of an association. I mean, sometimes you don't have like immediate legal and ethical phone calls that you can make. So that's a good resource to have. But maybe there is something setting up, like almost like a phone tree for oneself, about who could I call, who could I connect with, who could we create a community with. I'm always encouraging people to have like I have a number of different consult groups, so I'm encouraging people to build in like this sense of consult community, because it provides so much more than just immediate consult around this. But this idea of, I'm going to communicate with other people about the situation I'm in and the certain context, knowing that more than anything is the best ethical practice. Because there's another thing I think about here too, is that they're in this idea of someone coming in and maybe they're, if there's some sense of potential impairment or not, but there's some substance use piece, there can be a real, well, I'm going to make this simple. I'm just going to be like, oh, we're not going to see them. Like, that might be like, well, I feel like I have ethical safety if I just say no. But I bring up the question is like, well, is that ethical? Like, if just saying no and then potentially having someone not get support that they need, like, that could have been their step into a place of support, acceptance, openness, and treatment. And now I've just been like, nope, you're not here. Well, yeah, so you can't come. Well, maybe they need to see me and have these conversations before they can figure out where to get started. And in fact, we would pretty much understand that given some more evidence around that.
I really appreciate the point that you brought up about context. So thinking of my early experience, part of the context was I knew that from a operating heavy machinery standpoint, that was not a risk for that particular client. I also understood what that person's history was with the legal system, with therapists. Like, all of that context really came into play. And I think we naturally, as human beings, really seek to simplify. So we say, well, if that happens, then I'm absolutely not going to do that. Or if that happens, I'm absolutely going to do this. Because it takes away that confusion where it's like, nope, I have the thing I have to follow. And then you get this curveball and you go, and you realize that those rules that we've set up can degrade pretty quickly. And that context piece, where I want to spend a little time here, because I think it's an important point you're bringing up, It's like there's the context, and then there are also like your priorities in context. So one of the things that you've brought up is safety. And so it's like, well, how are any of us clinically conceptualizing safety? Like there's the literal risk of somebody hurting themselves or hurting somebody else. And then there's also this concept of like emotional safety, relational safety. And how do we weigh those in context when they may not line up?
Right. Because sometimes, there still can be some aspect of limit setting or containment, even while we're trying to build a relationship.
Right. It's like, and how do we sift through that? Because again, generally when these things happen, we have no idea.
Right.
You know, like I have absolutely, like, I've been working in community settings and you like go greet the client in the waiting room and then like their whole family stands up and you're like, what? We did not talk about this ahead of time, you know, like pivot.
Right.
And a client once who had a seizure, you know, like any of these things where we're like, oh no, I have no idea what to do right now. Like, how do we make decisions and feel secure that we can make ethical, careful, responsible decisions within that context?
Yeah, that's right. Well, first of all, I think there's a couple of things. One, I think it's important you're talking. It's like the importance of flexibility. You know, where we're working on potentially helping folks that we're working with develop some aspect of psychological flexibility. But this is where I'm always thinking, like, I have to have that too. And I have to have a lot of that because of these opportunities, these situations where we're constantly pivoting. And that's just the nature of the work. Something's going to be thrown here that as you can just expect it. So there's that. And then for me, I also bring in some like basic, like this will be my ground rules for functioning. And a couple things I'd like to think about with that. One is I'm always thinking about the spirit of MI. We talk about that in motivational interview, the spirit of MI, which is basically like, what's our therapeutic stance? And the therapeutic stance in MI, but it's consistent with a lot of ways of working, but it's one that really allows for this creation of psychological safety. And I like to really bring that up when I do like trauma-informed care trainings around the importance of how am I creating this environment where someone can feel emotionally safe in order to build the trust. People aren't going to talk and they aren't going to be honest about what's going on if they don't feel safe, if they feel like there's something that's going to be happening to them as a result. Again, and context, right? I'm always thinking of the context of someone's trauma history, just the environment that people are in, the kinds of micro and macro aggressions that they may have to be facing all the time, and my identity. And I have a lot of power as a therapist, also just like visually people looking at me might be making assumptions of, being like a white therapist. There's all these different pieces that are completely relevant. And how do I approach this in a way where folks can feel like they're not going to be harmed? So there is this emotional piece. And briefly in motivational interviewing, that's about, accepting people for how they come in and also just accepting the reality of their situation. Like, I might not like that this person is, using a particular substance or, whatever in a particular way. And it's not about me. It's about, this is their story. And how do I be present for it? How do I work on being compassionate and reducing their suffering? Like, what can I do to help reduce their suffering? How can I help give them power and choice and really be in partnership with them? And that's just kind of a little summary of that. And so if I have that base kind of laid, then sometimes if I have to do other things, like if there is like more of a limit setting piece that has to come up, it's within this context that we've already developed. And sometimes we don't have an opportunity to develop as much of it. We just got to know someone. But I think just this ability and willingness to stop, pause, listen, and just hear someone out. Like, again, if it's at the 911 level, it's going to be at the 9 where we just have to act. But most cases aren't like that. We have a bit of a place of being able to create this sense of safety. So if I do have to help them think about how they're going to get home safely, like, we're doing this in the context of care and potential collaboration.
Thank you for framing it through the lens of MI and also that recognition of kind of the spirit of MI, because I think it provides more direction. It's like if we can basically kind of remember why we're here. Other examples that I've been thinking of while you were talking, we started this considering substance use. other things that I know I have experienced about the unexpected. Again, it's not a 911 emergency situation, but it's something unexpected. The words that a client is using to describe someone or a situation, the way that they're dressed, you can't come in here dressed like that. And I've seen those situations, part of the reality of social media being what it is. Sometimes you can literally see in front of you threads between people talking about, well, I would do this, or you need to do this, or whatever it is, seeking consultation virtually in a way that is so different than how we would do it if you and I were sitting across a table talking to each other. But these ideas around you, client, need to show up in a certain way in order for this to continue. And I'll also note there's a big asterisk there, which is like obviously the therapist's safety and safety on many levels, which we have plenty of content and will continue to have content about these ideas of like, how do we cope with a client who's actively sexist, who is actively racist, who is making threats against people like us, all of that. Those situations removed. It's really interesting when we have set this frame around therapy, which is like basically in order to receive treatment, you, client, need to do X, Y, and Z. And I'd love for you to kind of speak to that, because again, these things are unexpected, but like I have absolutely been in consultation groups. Like I remember a colleague of mine talking about how a client came in nearly transparent clothing without opaque underthings on. Like talk about grist for the mill. Or a clinician not necessarily being comfortable with the profanity that a client is using. In order for us to keep talking, I need you to not use that word. Can you speak to that a little bit? Because again, these rules that we set are kind of all well and good until something actually happens and we go, whoa, what do I do now?
Yeah, and so that's really the situation, isn't it? Just like when we're setting rules, we're in such a different mindset than sometimes when we have to apply them. And so there's a place here about, okay, like I need to stop and reflect, like what's going on for me. And for some folks, for a whole number of reasons, we may have our own kind of bottom lines of just things that we can and can't see. But here's the thing I'm going to ask folks to think about, and this is coming from like a trauma-informed approach as well, is why do we have any rules? Clearly we do need rules, but this idea of if you can't explain to anyone like why there's a rule, like that's a problem. So if there's a thing about like, I'll just kind of give an example. Like maybe someone coming in transparent clothing, let's say, and I'll check with myself, like, can I sit with that? And again, we can't always anticipate everything that's going to happen, but for me personally, I wouldn't necessarily have a rule around that, but is there a need for a rule? Like maybe if someone's coming in and they're in a situation where they might be around a lot of other people where that could make them really uncomfortable. So it's the kind of thing like if I have a rule about, clothing or dress requirements, which actually I don't have one, but let's just say that with the example, being able to think about like who in the community might be impacted by this. And if it's just the therapist, like how can I plan ahead for some of these things? And we can't necessarily plan ahead for everything we could possibly imagine, but it's always about self-reflection, right? And always thinking about like, what if, or if this does happen, noticing what's going on and getting our own kind of consultation and support. But I really want to promote that idea of the why. If there's a rule, why is there a rule? I was trained, I don't know if you think of this, but I was trained, it's important for you to have your seat in the consultation room. Like it's a therapist's seat. Now, I think that's different from like making sure sometimes you sit next to the door. If you have a situation where you're not quite sure if something's going to happen, now that makes sense. Like that's a reason I can get behind. Like I may want to sit close to the door if I'm not quite sure what's going to happen in this. But this is different. It's like, it's your seat. And if someone sits in your seat, you have to ask them to move just because it's your seat and you need to be in that seat. And I remember always thinking, even as a baby therapist, like, really? Am I that fragile that if someone preferred that seat over this seat, I wouldn't be able to do my work? Again, some people might feel that way, right? But to be able to but what I did, put it this way, is I stopped and said, let's look at this. Let's look at what's important about that to me. And for me, I don't care where anyone sits. Again, if it's not a safety issue, like, you come in and make yourself comfortable. Like, that seems to be really important. But it's being able to kind of get ahead of some of these things and rules and be thinking about it. Another thing I'm thinking about too is, we're always assessing. We're always assessing a situation. And I think that's an important distinction, assessment and assessing, between like the actual formal assessment that we do. And I'm thinking of some of the work, that Daryl Childers, I know you've talked to Daryl before, was fantastic, about this idea of like, am I just, asking people to give me stuff and collecting information for what purpose? Whether we're doing that versus my ability to, at any moment, try to be so attuned that I'm constantly assessing, how's this person doing? What are they needing? Where are we going here? How am I feeling? Which is a lot of work. But that's the work, as opposed to constantly like just gathering more information. It may not be useful. It's about building this relationship, building safety, and being able to pivot and be responsive. Because I think it's always about pivoting.
Thank you. I appreciate that perspective. And I think the challenge with this too is like, you're like thinking of myself in these moments, you're processing information on so many different levels. And when I have found myself in those situations and in the 911 situations, all of a sudden you have, went from having a couple of things that you were thinking about that you're like, okay, like I need to check in with them about their panic and how has that been? And we have these kind of meta levels in our mind of different things we need to be asking for. But then when these things happen, all of a sudden it breaks out into all these different levels, all these different priorities. And like thinking of a 911 situation, it's like, yeah, when a client said, after this, I'm going to go home, I'm going to find my parents' vodka, and I'm going to take that bottle of medication that's in my backpack. And it was like, oh, like all of a sudden it just completely split off into different categories of all these things of like, where am I seated? Can this person get to the door? Would I block them if they try to bolt right now? Would that be safe for me? Would that be safe for them? Like, how do I stabilize them? Well, I call 911. It's like any of these crisis situations or sticky situations quickly complicate. How do you kind of work through that? It's so, and I think that's part of why we want to come up with the rules, because it's like so brain breaking.
It is absolutely brain breaking. And I think there's a place here. First of all, for self-compassion, like this is almost, maybe it is impossible in some ways to be able to kind of hold all of it in a particular way. At these moments though, I do have to say, this is a place where I think about like our work and I feel inside myself, okay, I'd like to see AI try to replace this, right? Replace this really, powerful and in tuned and, flexible responding. Oh my gosh. But, what do I do? Well, again, if it's the 911 thing, there's probably just going to be a move towards some aspect of doing the best I can to immediately make this person safe. In that case too, like if someone's saying like, oh, I have vodka pills, I'm going, I still have a little bit of room. Like a little bit of room. Like they're not out the door yet. They don't have the vodka yet. They don't have, and so the breath is always really important in the self-grounding of let me just try to make sure like I am in my body and in the chair and breathing and aware of myself right now. Because it's so easy just to scatter, like you said, to split off. And then the next thing I do, and this is, again, I think a lot of it's from so much MI training, is I just want to get them to talk about that. Right? I mean, if they get up and they run out, like, okay, then I'm in a situation like, okay, then I'll probably have to need to manage that crisis. But like right now, in the moment, they're sitting with me and they're willing to talk. And like, I'm just getting the sense that you are in so much pain right now. Like that this is your next step. Help me understand that. Or what else you're willing to talk about? Because in the talking, there's a couple things that happen. One's I'll find out more information. This is a case where information gathering actually probably is important, but also I'm able to continue to connect with the person. And this is really important for someone who's in such level of crisis, to be in a relationship with someone who cares and someone who listens. That does a lot to help regulate. It does. And if someone can't, that's also giving me information. But if they're able just to stay and just really simple kind of reflective listening about this is just so painful right now. You just feel like you're just so not understood. Just to be able to try to see it from their perspective, try to get behind their eyes, so to speak, about what's this like for you right now, and to stay in there is kind of where I go. And often, not always, but often, that's absolutely the right place to go. And trying to manage my anxiety. Again, that's why the breathing anxiety, to manage anxiety is happening, because it's so easy to become so activated.
Yeah, absolutely. One of the other complexities that I've seen come up in the last 5 years that wasn't new 5 years ago, however, certainly shifted the landscape. The COVID-19 pandemic put many of us online when we hadn't been. And that meant all of a sudden we were in our clients' bedrooms. We were in our clients' kitchens. We were there while they were making themselves a grilled cheese sandwich. And that's been another element of grist for the mill for me, to like see the things that therapists are bringing up and are struggling with, of like when a client pours themselves a glass of Merlot and they're in therapy with, when a client is vaping, when a client shows up to therapy wearing their pajamas because they're going to bed after, and we're like a hop, skip, and a jump away from wardrobe malfunction. But these potentially really like loaded situations that have so much intimacy. Can you talk about that stuff and like how you decision make? Because again, these are the areas where I'm like, I've seen therapists say I would never do therapy with a virtual client who came in, and had a bottle of wine and a glass next to them. How do you, Dr. Dempsey, make these decisions, particularly as someone who is so heavily trained and invested in harm reduction and motivational interviewing?
Yeah. So again, I think this is probably different for different folks. But here's the thing I think that's important to recognize is, you all know this, but it's just important to remember maybe, and I have to remind myself this a lot, like I don't control the space in the same way I control my therapy room, right? I only control half of it. They control the other half. And for part of that really activates all my control issues. And then the other half, it's like, this is fascinating. I'm going to really be able to see some things here that I can't always see. And I have had some interesting situations where people suddenly want to show me things around their house or what's going on. I know so many pets. So there's really a wonderful way of being able to see how people take care of themselves, how they express themselves. Does really build their safety. And like, where are the places of, for me, where it's like, it's on my edge. For me, and this might be, again, different for some folks, but I really set my limit around like other people showing up in the room or the people being in the room that I don't know about. And it's like, okay, well, I only have like earbuds on, but it's like, but they're still hearing like what you're saying if you feel safe with them. So I may pause, like, let's have a conversation about this. And sometimes, I will ask folks, and again, I can't always determine this because they can be hiding out in a corner somewhere. I just don't see that. I don't always know, and they can always choose not to tell me. But I've definitely had people like move into the car, into the bathroom, and lock the door, or a place where it felt appropriate for them to just find a place to sit with it in privacy. So that's like kind of my thing that makes me really uncomfortable when there's people around who might be listening in, and that is a really robust conversation about, what's okay. They can come. Like, well, let's talk about that. Let's talk about this being your space and what does that mean to have someone else listening in, and everything I use for grist for the mill. So that's the one where I think I'm the most activated and the most concerned. If someone goes and like pours a glass of wine, that's going to give me so much to talk about right there. And I don't have people doing that, probably because I know I'll just be like, just wondering about that. And I have folks who pour a glass of wine potentially. I haven't had that come up recently, where substance use disorder isn't necessarily something that's part of their presentation, but you don't typically drink in therapy. And so what does that mean? Like, is that really a problem to have a glass of wine? Like, they're not exactly impaired, but that could still be a really interesting thing to talk about. Like, you're choosing to do this. No, just help me understand, like, that particular choice.
It sounds like for you, you're like, oh, there's an elephant in the room? Tell me about
Tell me
the
about
elephant.
it.
Right. And I think that is often different than many social interactions that are non-therapeutic, where it's like, oh, this thing happened at the dinner party, and you're like, we're just don't look. I didn't, like, I don't want to embarrass them. Like whatever our reasoning is like, it's a different thing. But I think many times our own humanity is like, I don't want to talk about that. And so then we don't. And then we may try to come up with more rules. From your perspective, what's the potential damage here when we have like either a hardline rule out of the gate or we develop that rule? Like, okay, so let's use my case example. Client comes in under the influence. Based on the person's posture and presentation, it was clear to me that they were under the influence. And the person sat down, little bit of the rolling head, eyelids a little bit closed. Play that out. Like, let's say that we know that this client is not going to be getting in a car and driving home.
Okay. Yeah. My big thing is always like, I think I get out on the road. So if I know it's like they have a ride or somehow we can get them home. It's such a great question. So I might just be curious with them and just like noticing, hey, I'm noticing right now that it doesn't feel like you're all here. I'm just being able to notice your eyes. And they feel droopy and you're kind of moving, kind of listing from side to side, using the language that I think they'll understand. And just see how they respond. And I might say, well, I'm wondering, given what we've been talking about, or maybe even if we haven't been talking about it, I'm wondering if there's anything that you've been using that might be impacting how you are right now. Because it's not usually the way you show up. Or if maybe it's my first time, I'd be like, well, it's the first time I've seen you, and this might be because you've been using or not, and I wonder if something we could talk about. And here's the important thing about this. I just feel like this is so important. Like, okay, so maybe they're a bit out of it, and maybe they're not going to be really, really sharp. But what's so important here is not so much that I'm going to get like wonderful therapy done with this person. They're going to have this great insight right now. And I also don't have this sense of like being disrespected. There's a reason folks are showing up. And again, their context or history, what have you. All I know is I'm glad this person's in the room. And that if they've shown up, there's something that seems to be really important in some way. It's like, well, they're mandated because, they'd be in trouble if they didn't. Well, that's a good reason. That's a great reason. They still showed up. So that's great. And then there's just this like curiosity I'm going to hold because I want them to come and to come back. That's the most important thing. I want to be careful and not be rigid. Like, I need to be the flexible one in some ways. And clearly, this person could then start doing things that would be inappropriate. Let's just say not. Like, they're trying to engage. They're, kind of in a, maybe some aspect of a stupor. But what's important to me is if I start to become real hardline about, no, I'm not going to ever talk to you. You have to be here, completely like abstinent. If you don't, you're breaking a rule of therapy. Well, then they might not come back. It's likely they might not come back, right? I don't feel psychologically safe. I mean, those aren't necessarily the exact words they use, but there's some sense of like maybe even shame. I think shame is so toxic. Rejection. And so I myself personally think, okay, there's like a legal and ethical issue about whether or not we see someone under the influence, but what's the legal and ethical issue about having rules that keep me from seeing someone under the influence as well? Because this person, they may not engage again, and that's tragic, right? And that could keep them from care, and maybe if they don't get care, like there's going to be consequences from that. So I think there's an easy answer to this, but I do like to fall on the side of more flexibility on my end while still, being conscious of, various aspects of safety for them or for the community, for sure.
Thank you for that answer, because I think it provides so much to think about, again, in that really rigid interpretation about the ethics. Just for kicks, play with me, Kristen. Another one we haven't talked about, when a client lies to you. So you say to that client, your eyes doing this thing I haven't seen them do before. Been using? Can you tell me about that? Nope.
Yeah. So with lying, there's a certain amount of I don't care. on some level. So this comes up in motivational interviewing training all the time. But what do you do if someone's lying? Well, I don't know if I'd ever be able to figure out if they weren't lying. And here's what I learned. And I think this is consistent with really a lot of what's been taught in motivational interviewing, at least for a long time, is if I can create enough psychological safety and people don't feel like they're going to be punished and they start to feel safe, they'll start to tell the truth. And I have lived this so many ways, so many times with so many people. Often, like I may know for like sometimes months and years, like someone is probably not telling me the truth. I don't necessarily have evidence of that. And unless I'm, doing some sort of testing, and that's another issue, which I'm glad to talk about, I won't necessarily know, and that's a reason for UA testing a lot of times, right? That's your analysis, is to like catch somebody and to make sure that they're not lying. But if I just create this situation of, hey, I don't know. Okay, you say, no, okay, fine. I'm just noticing that. Like, it seems like there might be something that's happening right now that's making it harder for us to engage. And that when I say these things, I notice that maybe you're drifting a bit. Help me understand that. So I'm able to maybe develop some discrepancy a bit, to like maybe what they're saying and what they're doing. And just being curious about that. And again, when I create enough safety about, hey, listen, it's not about me catching you. It's about being honest so you feel safe to keep talking so we can make some changes for you. Folks will sometimes gradually start to be more and more active about the truth, so to speak, or their truth, as it might be.
Thank you for that example. I think that's a really helpful one because like the lying thing totally comes up. And I've heard and seen therapists say if a client's going to lie to me and I find out, then I won't do work with them. And it sounds like for you, to really simplify, if we were to make this kind of hierarchy of considerations, number one is physical safety of client, therapist, community. And second is emotional safety, and not just of therapists. And I want to point that out because I think, like, when I think about the rules and why we do them, and then also like the potential negative consequences for the client or for the rapport or whatever it is, in that moment, we're probably not really prioritizing the client's emotional safety. We're prioritizing our own. And there are absolutely times where, again, big asterisk here, where we need to do that. And outside of those times, it's like then we have just reinforced power dynamics that are probably not helping our rapport or relationship by saying, oh, well, you can't do that here.
Right. And again, it's like, why not? And if there's no good reason, then that creates distrust. And it is absolutely a use of power, if not an abuse of power. Absolutely is a problematic use of power. And that's where you get folks being like, well, to help you, on some level, right? Of just like not trusting and not having that relational connection that we really need to do the hard work. And again, so many folks we work with are from communities and situations and histories where they've been harmed, and therapists have harmed folks. Not in like the big bold way always that we think of in terms of like sexual abuse. I mean, that's the kind of the worst horrible examples that we're thinking of, but also in all these other kind of little ways that are just, they're really painful and hurtful. So I always think about like, why is this rule here? Why do we have this? And that's actually a great exercise to do in a group, like at your practice or what have you, of just like, let's look at some of our rules. Why do we have them? And sometimes they're good rules, and then it's like, okay, now I can really start to think about, we have the conversation about how to articulate this so folks understand why we have this. But then we may have rules too that just have never been good. We may have rules that at some point actually did serve a really good purpose, but they don't anymore. Like, oh, if this is outdated, we don't need this. That's a very helpful exercise to have. Why this rule?
I appreciate that thought and that recommendation. If you are, initially prioritizing physical safety of therapist, client, and others, and then dropping down underneath that, you're like, okay, we're good there, I think. Then you're looking at the client's emotional safety, your own emotional safety. Does it then become a little simpler for you? Because like I know, I can feel it. Like there's like this little raisiny thing that happens in my chest when I'm like, yeah, definitely making this about me right now. Like that one thing that happened in college and what I think the client should do, and it's like, I can feel it. Like gratefully, I've gotten better at feeling it, and I will feel it and my mouth stops. And I have to like work on like grounding myself and my body language and everything else, like in a perfect world. I think we're, I'm absolutely generalizing here, but I think we as therapists, we're really afraid of doing the wrong thing. And we're used to operating with these rules that come from perhaps centuries old conditioning that substances are bad. That's not harm reduction. That is absolutely not harm reduction. Like that, it's like if you were going to do meaningful therapy, you cannot be under the influence. You cannot be vaping. You cannot be smoking. I mean, for anybody who's ever worked in addiction treatment, if you didn't allow smoking, like...
That's a challenge, yeah.
Right. Like, it's like it sounds like there's a lot of homework here for us as clinicians to like probably pretty rapidly kind of stop yourself and be like, why is this rule here? And why am I reinforcing it? But that, again, that's one of those processes is like, it's really, really fast.
Right. So complexity kind of requires us to be, kind of engaged and curious and open, and to trust that process, and to be able to pivot and to work. I mean, it's a lot of hard, really engaged work. And I love what you're talking about, Beth. I encourage people to do that. Like what do we do with this instead of rules? Like that level of awareness. Like you're able to drop in and notice. Oh, I'm noticing this in my chest. I'm noticing this here. You start to notice your things. And one of the things we teach in motivational interviewing, which I love and I talk about all the time, I was talking about it earlier today, is that sense of, are you dancing with someone or are you wrestling? And I love this idea of like, it's a process-oriented thing. Like if my process is working out well with this person, we'll be in sync. And it'll feel like we'll be moving along together. Like that sense of dancing. This is working out. It's working out. And then we often have to pivot. Like we make micro pivots all the time. Like, oh, I'm kind of going in this direction. They don't really want to go there. I'm kind of looking at a tool. They don't really want a tool right now. They just want to keep. And so I'm able to kind of, maybe poke along here, see if it'll work. It's they're pushing back. We're doing a little bit of wrestling. Okay, I'm going to back off from that. And then clearly, if there's places where it seems like you're doing a lot of wrestling here, to be able to stop, maybe we have a conversation with this person if it feels like it's something they can engage in. Maybe it's something I step back from and have consultation with someone else first. We have some options, but what's important is I'm able to recognize, like applying a rule here right now or trying to get something done or trying to have an outcome, can't control anything. Really I can be responsive to the process, and I can be thoughtful about how to do my next intervention. But ultimately, I'm not going to be able to ensure that we're going to have a certain something happen here. And that rules, I think sometimes we feel like, okay, this is going to help us tame some of this complexity. And again, in places where we really do need to step in, it makes a lot of sense, that we know when someone's going to imminently harm someone. And that's where we really learn that and practice that in our law and ethics. But there's so much else that's about being really attuned to ourselves and having our sense of how do I respond to this? Where do I stop? Where do I connect with someone else? Get some feedback. And I also believe too that sometimes we're in a situation where maybe we're having this response to someone, and we don't always know it or understand it. It's like I have to kind of look at this a little bit, and maybe I get some consultation, or maybe through my own process I figure that out. And I really encourage folks to kind of come back to that. Last time we were talking about such and such, and I've been thinking about it, and this is what I'm thinking, and what do you think, to kind of reintroduce it. It's actually kind of a nice way to create some continuity between sessions. I've also had people, when it's a tough situation too, like appreciate the fact that I thought about it and that I put the effort and time into thinking carefully about how to respond, even if, sometimes maybe especially if, it was a tough topic.
We haven't used the term yet, but I'm going to throw it out there. Countertransference. And it seems like a lot of the concerns we have about these sticky situations stems from our own belief systems that we've operated in probably forever, and having to kind of unpack that. So if you're working with a client in one of these sticky situations, you said really focusing on reflective listening and curiosity. What are some other things that you find that you integrate in these situations to try to, help clinically manage, quote unquote, what's happening?
Yeah, I'll use some of the MI skill set and some other pieces as well. So reflective listening is really kind of our superpower here, because when I'm able to reflect back what you're saying, and it doesn't have to be like in a very simple paraphrase, although simple reflecting is often great when someone is particularly agitated or distressed, because we're not adding in extra meaning that they might reject. But there's something that's really important about you can have your experience. I can be here. I can not only manage, tolerate it and manage myself, but I can show you that I'm engaging with you by reflecting this back. Like there's the meta messaging around reflective listening is really powerful. And you could be saying things that maybe in other places of your life, people have told you were deplorable, and really evoke shame in so many ways. So my ability to do that's so powerful. Summarizing is really important too, when I'm able to notice dominant themes and pull them together. So many times people can be so dysregulated. There's so much going on that for me to be able to pull together, here's a number of things I'm noticing that's going on, especially when language of change is starting to occur. I'm hearing you say, like, you're not really thinking about quitting yet, and you're also tired. You're tired of waking up hungover, and you're tired of spending a lot of money. Like those kinds of things that help them get to a very specific awareness of some of their change language. We also use a lot of affirmation, which I love, which is like noticing people's strengths, enduring strengths in so many ways. Like even in situations that might seem like difficult or maybe isn't their best moment. I mean, sometimes I can affirm just they're getting through like not their best moment. Like it takes a lot of courage to show up today and to start to talk about this, given all that you told me that you've been through in terms, of the DUI and the courts and losing your license. Like being able to notice that this is still courageous and they still have willingness. Some of those traits are really helpful. I also like to, speaking of countertransference, think of this is, if I'm noticing like affect coming up in myself and kind of using that level of self-disclosure around some of the feelings I'm having just to maybe deepen some of our connection. So I like to use self-disclosure to build relationship. And I kind of do it that way. Like when you were telling me about, you're being arrested, let's say, I noticed the kind of, as you're talking, just kind of the sadness in my chest. And I get the sense that this is really a difficult and sad situation for you as well. Something like that, like being able to reflect on some of the stuff coming up for me is a really great way of using some of this emotional material that I think people find often very helpful and also builds that trust awareness. And then another thing in the MI toolbox too, which I'll bring up, which is so helpful. This is so critical. About giving information or advice is that we ask for permission first. And that's such an important piece. It's so simple, but it's so positionally important that before I tell someone, hey, have you thought about this? Or here's some information or whatever it might be, is I, first of all, ask like, what kinds of things have you been thinking about already? Is there something you'd like to ask me? And if they have no thoughts or there's not much there, or it's kind of feels like I could give some information, I then ask. I say, I've been thinking about what you're saying. I have some thoughts about that. If it would be helpful for me to share them with you. And so they can say no. And that's really important. They say no. It's like, okay, just let you know, happy to cover this. But if they say yes, then if it's advice, I'd like to give them a menu of options. So it's not just one thing, but maybe it's like 3 or 4 different things that they could choose from. And then we check in like, hey, what do you think about that? So get some feedback from them. And if it's information, I like to think about maybe, a couple, like a paragraph, a couple sentences. So it's not overwhelming them with lots and lots of content, which also is difficult for people. And then we always check in with this like second ask of like, first ask being, what do you want? Second ask being, how is this for you? Is this a helpful thing? And in that way, we're able to negotiate some aspect of partnership, Like, this is not about me telling you, but you have choice around this. And we also support autonomy because there's always a messaging of, this is up to you. Whatever we do here, this is your choice.
Everything that you just suggested, I think, is also a break from the early origins of established psychotherapy. And I think because we come from that, at least in Western culture, that, where power was always, or at least very often, front and center. This is what I think as a clinician about what you're saying, client. This is what I think you should do, or what you need to do, even more, like a lot of power. I can see that that's where we as clinicians could get lost because of this idea of, like, basically we need to be moving a client through this treatment plan in order to feel like we're valued or we're doing a good job or whatever it is. And what you're suggesting is really to kind of like reevaluate your focus in that moment, to reiterate what you've already said, kind of like, how do I establish and maintain trust and safety with this person? And that is enough.
Yeah, and what that does is that leads to good process, like the good process of creating this emotional safety, the connectedness of being heard, the reduction of shame, understanding people's context, like really that understanding, that's good process. And good process will be more likely to lead to good outcomes. Because there's always some people who come right into good outcomes right away because they're just, their level of motivation, what have you, or luck. But many times it's a good process that will get us there. And it might feel like, well, it's not, it's going to take too long. It's not fast enough. But that's counterintuitive sometimes because many times we're trying to kind of drag someone along towards something that we think they should get to. Like, it actually often takes longer. And I think Bill Miller has this in the newest edition of the Motivational Interviewing book. It's like, if we, act and behave as if, we don't have enough time, it could take all the time in the world. If we act and behave as if we have all the time in the world, it could take no time. This is some version of that. Like, it's this counterintuitive way of being in this process. And then also, I think too, like with our more traditional trainings, this idea of like interpreting, or analyzing, or kind of trying to impose some sense of, our sense of understanding someone's life and like what would be best for them. Like, that's kind of more of a traditional way of thinking, and often based on theoretical orientations. It's also like really incredibly culture bound and it's not sharing power in any particular way. In fact, we have the power in that situation. Of course, people are going to feel like, even unconsciously, like, no, this is what I want.
I'm looking at the clock and I am not happy with it because I want to keep talking about this. And we are out of time for our hour together, Dr. Dempsey. You've already mentioned some resources, motivational interviewing, feedback-informed treatment, and deliberate practice. You mentioned Dr. Daryl Chow. What are some other resources that you want to offer to the clinicians listening today? And I also was thinking or just self-questions to ask yourself. And then also, how do people get in touch with you if they want to learn more about you and about your work?
Yeah, so I'll start with that first. So my website's a great place. This is Kristen at KristenDempseyCounseling.com. So it's Kristen at KristenDempseyCounseling.com is my email, but KristenDempseyCounseling.com is my website. And Kristen is with 2 I's, so it's kind of an important distinction there. And I'm also on LinkedIn, and I'm also on Blue Sky. And thinking about this, just as we're kind of thinking about context and environment and everything that's going on right now, there's a lot happening in the world. I don't need to say that. And there's a lot that people are bringing into our sessions that is complicated. I mean, there's just people are reacting and responding to so many things and so many unknowns, and there's just a lot to manage, and we're managing kind of our own anxiety around all of this. So I think important things to kind of remember about this is that it's really easy in times of overwhelm with all of this stuff to just want to kind of turtle in and hide out. And the importance of remaining connected to our values, to the things that we care about, to each other, to our purpose, to the meaning that we bring to our work, that's really important. Balanced with rest. So it's just both, about moving forward and doing things that feel really important to us and being active and responsive. and claiming some aspect of our power, while also taking steps back and resting when we need. And I'll just also say, in all of this complexity, a couple things that we have. We have the present moment, and we have each other, which I know doesn't sound like a lot, but really in so many ways, that's kind of all we've ever had. It's like, if you think about social movements and the way the world's changed in ways that have been positive, it's about coming together and building movements and being, kind of in our power together. And I just kind of like to end with that because I think that's such an important and positive and kind of hope-infused way to end this conversation. I so appreciate having it.
Thank you. I really appreciate it. It's always wonderful to spend time with you and hear from you. And I think you've given all of us a lot to think about. Again, for our listeners, Dr. Kristin Dempsey, thank you so much for joining us.
Thank you so much, Beth. It's been wonderful.
You've just finished listening to another exclusive Continuing Ed podcast by Clearly Clinical. If you like what you just heard and you need Continuing Ed credits, please visit us at clearlyclinical.com to check out our one-year membership, where you'll have access to our growing library of Continuing Ed podcast courses. Clearly Clinical, where our goal is to help you learn, grow, and shine.